It's also a good time to remind your dad about important health screens that could help him live longer. We're joined here in studio this noon by Dr. Grable from Community Physicians Network to talk about cancer screening for guys. So let's start first of all with some of the different cancers that are really being looked at and under the microscope, because it really varies by men's age.
Well, thank you very much for having me. And to those dads, happy Father's Day. The best thing you can do for your family is to stay healthy. We know there are some cancer that if we find early is highly curable. And today I want to focus on colorectal cancer, prostate cancer, and for smokers, lung cancer as well.
Okay, the first one right there on your screen, colorectal cancer. When do you need to start those exams, and what's sort of the timeline for those?
The recommendation right now for someone who does not have any risk factors is to have colonoscopy at age 50. And it can be done every 10 years, but if you're found to have polyps, if you have family history, if you have some genetic defects, then you need to talk to your doctor about doing it earlier.
Some big keys there. Prostate cancer, I know that's one that really impacts so many men. When is the sort of new research recommending that you get screened for that, and how often?
So there's just been a new change on the recommendation on screening for prostate cancer. The PSA is now recommended for men at age 50 to 69 that they are to have a conversation with their doctor. We know that if prostate cancer is found early, they can be watched and treatment can save their lives.
A very big concern there.
If they do have family history, they need to start at 50, and if they have multiple family history, close relative, what we call first-degree relative, fathers, brothers, then they really should start at age 45.
And I know lung cancer is another huge one as well. This is kind of regardless if you smoke, it really depends on that.
There's the low risk CAT scan, low radiation CAT scan that's available for men who are smokers, particularly those ones who smoke that we call having a smoking history of 30 pack years. So you take how many packs a day you smoke, multiply by the number of years that you smoke. If that's 30 or more, and you're still smoking or have stopped smoking about 15 years or less, you should get that done yearly.
Some very big tips. No, 3 big cancers that are very crucial when it comes to our men being around even longer past this Father's Day and beyond. Dr. Grable, thank you so much for joining us. We have more information on WTHR.com.